If you've been dealing with digestive discomfort, bloating, or just feeling like your stomach has a mind of its own, you're in the right place. Today we're diving into Irritable Bowel Syndrome, or IBS. It's a condition that affects millions of people worldwide, but despite being so common, it's often misunderstood. In this video, we're going to cover everything you need to know about IBS, the signs and symptoms to look out for, what might be causing it, triggers that can make it worse, and, most importantly, how to manage it effectively. 1. What is IBS? Let's start with the basics. What exactly is IBS? Irritable bowel syndrome is a chronic condition that primarily affects the large intestine. It's what doctors call a functional gastrointestinal disorder, which means it doesn't cause physical damage to your intestines, but it affects how your digestive system works. IBS affects about 10 to 15% of the global population, with women being twice as likely to be diagnosed as men. IBS isn't life-threatening, but it can significantly affect your quality of life. The symptoms are often unpredictable and can be embarrassing, making it hard to manage social situations, work, or even daily activities. There are three main types of IBS based on the symptoms you experience: IBS-C, IBS with predominant constipation; IBS-D, IBS with predominant diarrhea; IBS-M, mixed IBS, where you alternate between constipation and diarrhea. Understanding which type you have is key to managing your symptoms, so keep this in mind as we go through the rest of the video. 2. Signs and symptoms of IBS. Now let's dive into the signs and symptoms of IBS. Everyone's experience is unique, but these are the most common symptoms reported by people with IBS. A. Abdominal pain or cramping. This is the hallmark symptom of IBS. The pain is often in the lower abdomen and can range from mild discomfort to severe cramping. It's usually relieved after a bowel movement. B. Bloating and gas. A lot of people with IBS report feeling like their stomach is constantly swollen or full of gas, which can make you feel self-conscious or physically uncomfortable. C. Changes in bowel habits. Well, you might experience diarrhea, constipation, or even alternate between the two. This unpredictability is one of the most frustrating parts of IBS. D. Mucus in stool. You may notice white or clear mucus in your stool. This is a common symptom in IBS, but less so in other conditions. E. Urgency or difficulty with bowel movements. Oh, some people with IBS feel an urgent need to go to the bathroom, while others feel like they're never able to fully empty their bowels. Sound familiar? These symptoms can be disruptive and even isolating, but there's hope. Keep watching because we'll discuss how to take back control of your health. Additional point, it's also important to note that IBS symptoms can come and go. You might feel fine for weeks or months, only to have a sudden flare-up. That's why it's essential to track your symptoms to identify patterns and triggers. 3. What causes IBS? One of the biggest mysteries about IBS is its cause. Doctors and researchers don't have a definitive answer yet, but there are several factors believed to contribute to IBS. A. Gut-brain axis. Dysfunction. Your gut and brain are in constant communication through the gut-brain axis. If this communication breaks down, it can lead to increased sensitivity in the gut and irregular bowel movements. B. Stress. Stress doesn't directly cause IBS, but it can definitely make symptoms worse. Stress hormones affect your digestive system, leading to flare-ups during high-stress periods. C. Dietary triggers. Certain foods, especially high FODMAP foods like garlic, onions, and beans, can trigger IBS symptoms. Spicy, greasy, and processed foods are also common culprits. D. Hormonal changes. Hormonal fluctuations, especially during the menstrual cycle, can exacerbate IBS symptoms in women. E. Post-infectious IBS. For some people, IBS develops after a severe gastrointestinal infection, like food poisoning. This is known as post-infectious IBS. F. Gut microbiome. Imbalance. Your gut is home to trillions of bacteria. An imbalance in these bacteria can contribute to IBS symptoms. While there's no single cause of IBS, understanding these contributing factors can help you identify what might be triggering your symptoms. Common triggers for IBS. Symptoms. Triggers are different for everyone, But there are some common factors that tend to make IBS symptoms worse. Let's go through them. A. Dietary triggers. O. High FODMAP foods, like onions, beans, and certain fruits. O. Caffeine, alcohol, and carbonated drinks. O. Dairy products, especially if you're lactose intolerant. B. Stress and anxiety. Even minor stress can lead to major IBS flare-ups due to the gut-brain connection. C. Irregular eating habits. Skipping meals or overeating can upset your digestive system. D. Medications. Certain antibiotics, antidepressants, and even over-the-counter medications can aggravate symptoms. E. Lack of sleep or exercise. Sleep and physical activity play a crucial role in gut health. Poor sleep or a sedentary lifestyle can make IBS symptoms worse. 5. Diagnosing IBS. If you suspect you have IBS, it's important to get a proper diagnosis. IBS is often a diagnosis of exclusion, meaning doctors rule out other conditions before confirming IBS. Steps to diagnose IBS. A. Medical history and symptoms. O. Your doctor will ask about your symptoms, when they occur, and how long you've been experiencing them. B. Test to rule out other conditions. O. Blood test for celiac disease. O. Stool test to check for infections or inflammation. O. Colonoscopy to rule out conditions like Crohn's disease or colon cancer. C. The Rome criteria. Doctors use the Rome criteria to diagnose IBS. This includes recurring abdominal pain at least once a week for 3 months, along with 2 or more of the following. O. Pain related to bowel movements. OA change in stool frequency, or OA change in stool appearance. 6. Managing IBS symptoms. Managing IBS is about finding what works for you. Here are some strategies that have helped many people with IBS feel better. A. Dietary changes. O. Try a low FODMAP diet. This involves eliminating certain foods and gradually reintroducing them to identify triggers. O. Focus on whole, unprocessed foods and avoid artificial sweeteners. B. Stress management. O. Practice mindfulness techniques like meditation or deep breathing. O. Consider therapy, especially cognitive behavioral therapy, CBT, which has been shown to help manage IBS-C, medications and supplements. O. Antispasmodics for pain relief. O. Probiotics to balance gut bacteria. O. Fiber supplements for constipation or diarrhea. D. Lifestyle adjustments. O. Stay hydrated and drink plenty of water throughout the day. O. Exercise regularly, even if it's just a 20-minute walk. O. Get 7 to 9 hours of quality sleep every night. E. Tracking symptoms. O. Keep a food and symptom journal to identify patterns and triggers. Before we wrap up, let's answer some frequently asked questions about IBS. I. Can IBS be cured? O. No, IBS can't be cured, but symptoms can be managed effectively with the right strategies. T. Does IBS lead to more serious conditions? O. No, IBS doesn't cause damage to your intestines or increase your risk of diseases like cancer. What's the best way to prevent IBS flare-ups? O. Identify your triggers and stick to a balanced, low FODMAP diet. IV. Can stress alone trigger IBS? Oh yes, stress is a major trigger for many people with IBS. Living with IBS can be challenging, but with the right tools and support, you can take back control of your life. Start small, track your progress, and remember, you're not alone. If this video helped you, please like, comment, and subscribe for more health content. Let me know in the comments your biggest takeaway or share your tips for managing IBS. Thanks for watching, and I'll see you in the next video.